Have you been struggling with knee pain for the past couple of weeks and simply can't shake it? Does it hurt to walk up and down stairs? Or if you've been sitting for too long, does it ache when you go to stand up and walk? If this sounds like you, then check out the video I've done this week. It's on a really quick taping technique that anyone can do within 5 minutes that should reduce your knee pain by about 50%. Stay tuned. Hey, it's Nick here from Benchmark Physiotherapy. Now, the taping technique that I'm going to show you this week is a McConnell taping technique, which goes over the top of the kneecap and provides support to the knee to reduce pain, as well as allow the muscles to get a bit stronger. So this type of technique is for someone that has osteoarthritis in either their knee joint or their kneecap joint, or it can also be used in the younger population for people that are struggling with knee pain. So I'm going to switch over to the plinth and I'm just going to show you exactly how to do this technique by yourself at home to reduce your knee pain by about 50%. Okay, so the taping technique, as discussed, is called McConnell's taping technique. And the first thing we need is some Fixamol to go over the top of the knee. Now, start with the knee straight, go from the inside to the outside, and we'll measure that up first. Should be about 3 or 4 of the big squares. Okay, so we are going to peel that away and then go from the outside of the kneecap. So we measure, that's the top of the kneecap, that's the bottom of the kneecap, and we're going directly from the outside line of the knee across to the inside. Okay, then I like to prepare 2 additional squares or rectangles that will go below the knee. Okay, and so we're going to go up one there. So the way that you work this out is if that's the middle of the kneecap and that's the length of the kneecap, that's what's called the inferior pole, down the bottom of the kneecap, right down the sharp bottom part. We're going to lay one on the outside and we're going to lay the second one on the inside, just with a slight pull that way, and you should be left with a small pocket of skin just underneath the inferior aspect or the lower aspect of the kneecap. Then with your rigid strapping tape, we start again over the top. Okay, now this is probably the only tricky part. You are going to position it on the outside. You're going to pull across and lay that one down, so there's a couple of folds there. And then we're going to come up the inside. So positioning bottom, pin it down, pull it up, hold it down, and go on the inside. Okay, so the kneecap's been pulled up, pulled across, and then I just like to tidy it up by going all the way across. Okay, so there you have it. That's the taping technique, the McConnell taping technique for kneecap pain. So a couple of things, couple of pointers. Rigid tape and Fixamol is what's required. You can get that from your physio. It's really important that if you're allergic to Band-Aids or if you've had an allergic reaction to tape in the past, then don't do it. If it gets red or itchy or you start to see a little bit of tissue irritation, take it off straight away. Okay, most of the time you shouldn't leave it on for more than 48 hours unless you have pretty tough skin. And then when you take it off in the shower as well, and make sure that you put some moisturizer or some aloe vera to soothe your skin overnight before you tape it again. Now, most importantly, the physio should always assess your aggravating factor before and then tape you up and then reassess your aggravating factor to make sure that the taping has been effective. If the taping technique has helped, then the good news is that most therapy, McConnell therapy programs will help as well. So that includes releasing muscles on the outside of the leg and strengthening muscles on your inside of your leg, as well as potentially some orthotics and a few other things that your physiotherapist will talk to you about. So if you'd like to know more, then just have a chat with your physio from Benchmark Physiotherapy, and keep an eye out for more content on knee pain and other topics over the next couple of weeks.